Good afternoon. Thank you for joining us again today. I'm joined by our new Chief Nursing Officer, Amanda Croft, today, and by a more familiar face, the National Clinical Director, Jason Leach. Both of them will help me answer questions shortly. Firstly, though, I will recap briefly on the changes that have come into force over the past few days. More substantially, I will give an update on the Scottish Government's expectations for secondary school reopening after the Easter holidays. But before any of that, I will give the usual update on statistics. I can report that the total number of positive cases yesterday was 259, which is 2% of the total number of tests carried out, and means that the overall number of confirmed cases is now 220,493. Of the new cases reported yesterday, 93 were in Greater Glasgow and Clyde, 44 in Lothian and 32 in Lanarkshire. And the remaining cases were spread across 6 other health board areas. 196 people are currently in hospital. That is 19 fewer than before the Easter weekend, which is when we last reported this figure. And 21 people are currently receiving intensive care, and that's the same number as before the Easter weekend. I'm also pleased and relieved to report that no deaths were reported yesterday, but I should point out that, as you know, yesterday being Easter Monday was a public holiday and many registration offices were therefore closed. So it may be that the no deaths being reported today is an underestimate, which we will see reflected in statistics later in the week. But the total number of deaths registered under the daily definition that we use is now 7,614. And that number, of course, reminds us of the impact that the virus has had on many, many families across the country and the grief that it is continuing to cause. So again, my thoughts and condolences are with everyone who has been bereaved. Let me also provide an update on the latest vaccination figures. As of 7:30 this morning, 2,577,816 people have received the first dose of the vaccine. That's an increase of 12,536 since yesterday. In addition to that, 7,406 people received their second dose of vaccine yesterday, and that brings the total number of second doses that have been administered now to 463,780. So virtually all over 60-year-olds have now received at least the first dose of the vaccine, and so too have 92% of 55 to 59-year-olds and 72% of 50 to 54-year-olds. So far, as you are aware, we have been using both the Pfizer vaccine and the Oxford AstraZeneca vaccine. I can confirm, though, that the first batch of the Moderna vaccine arrived in Scotland safely yesterday. A total of 17 million doses of this vaccine have been ordered for the UK, and of that total, Scotland will receive well over 1 million doses. It's important to stress, though, that Moderna vaccines will arrive over a period of months, not all at once, and the doses we expect to receive are already factored into our forward projections. So the arrival of this first batch doesn't mean that we are able to accelerate the vaccination programme. The speed of vaccination is already taking account of the expected Moderna supplies. Nevertheless, the fact that we now have 3 vaccines in use is clearly very welcome, and it does give us additional security of supply, which is important. The figures I've just reported demonstrate again the progress that we are making in terms of vaccination. I want to stress that we are still on course to have offered a first dose of vaccine by the middle of this month to everybody in the population who is over 50 years old, everybody who is an unpaid carer, and to all adults who have particular underlying health conditions. And that is a really important milestone, because these groups taken together, these are the initial JCVI priority groups, and taken together, these groups account for well over half of the adult population in Scotland, but also 99% of COVID-related deaths. So you can see that reaching that milestone is very significant and is one of the things that will give us confidence, we hope, to further ease restrictions later on this month. We're also seeing